Capacity Development webinar on leveraging governance and spearheading innovative solutions to address the COVID-19 pandemic responses in Africa. My name is Adriana Alberti from the UN Department of Economic and Social.
This is not waiting to this one.
No, but it's paid.
I don't even know if it's connected.
Division for Public Institutions and Digital Government, and I'm in charge of the Program Management and Capacity Development Unit. My division and our project.
Well, it's faint. For this.
My division and our project office, UNPOG, are pleased to welcome the speakers. We have a rich agenda today and a group of very excellent speakers from Africa and other regions of the world. Before we get started, I would like to go over a few items with you so that you know how to participate. So those who are not speaking, to kindly unmute themselves, to mute themselves, otherwise there will be background noise. So the webinar will be recorded and it will also be live streamed on DESA Facebook. You will have the opportunity to post some questions through the chat function on both WebEx and also Facebook. We have also gathered questions. I would kindly like to ask those who are not speaking to mute their microphones because there's a little bit of noise. Thank you very much. So we also gathered questions during the registration process, and we will also have a follow-up webinar in Africa. So you will also get the opportunity to respond, to hear some responses in the next webinar. I would like to mention that as of this morning, we have 401 participants from 82 countries that are connected, and therefore, you know, it is also to be expected in a webinar to have some noise, but I really ask for your collaboration in keeping the microphones muted. And we have 229 participants from Africa. So we are delighted now to open this webinar. And it is my great honor and pleasure to introduce Mr. Elliot Harris. He is the Assistant Secretary General for Economic Development and the Chief Economist of the UN Department of Economic and Social Affairs, who will deliver his opening remarks. Assistant Secretary General, Mr. Harris, you have the floor.
Dear colleagues, ladies and gentlemen, good morning, good afternoon, good evening. On behalf of the United Nations Department of Economic and Social Affairs, it's an honor to welcome you to this webinar. As Adriana said, the webinar brings together today high-level government officials and representatives from civil society organizations, from the private sector, academia, public health experts, and regional and international organizations. And so in order to get as much benefit from this illustrious group of participants, I'm going to keep my remarks very short. I'd like to thank you for your participation. I wish also to thank our partners, namely the UN Economic Commission for Africa, the African Union Development Agency, and the African Association for Public Administration Management. I wish also to thank the UN Development Cooperation Office for Africa for joining us at this webinar. The aim of today's webinar is to provide a platform for sharing different experiences, effective governance approaches and strategies, and lessons learned to strengthen government capacities in the fight against COVID-19. We face challenges at both the global and at the regional levels. As an increasing number of countries, both developed and developing, are struggling to cope with the outbreak of the COVID-19 crisis, countries in special circumstances are facing an unprecedented threat to human life, social cohesion, and economic devastation due to their fragile healthcare systems and their socio-economic vulnerabilities. The COVID-19 pandemic calls, therefore, for unparalleled actions from us all. As the United Nations Secretary General, Mr. Guterres, highlighted in a recent statement, and I quote, "Human health is the quintessential global public good. In an interconnected world, none of us is safe until all of us are safe." COVID-19 respects no borders. COVID-19 anywhere is a threat to people everywhere. In the African context, the COVID-19 virus has unfortunately been reported in almost all countries in the region. We've witnessed a steady increase in the number of COVID-19 cases. As of yesterday, the cumulative total of approximately 65,000 confirmed cases, with 2,293 deaths, have been reported across the region. Many Africans living in tight quarters in urban areas with high population densities will be very easily impacted. It is urgent, therefore, for governments in the region to take swift action to respond to the COVID-19 crisis. Effective, accountable, and inclusive institutions, along with innovation in service delivery, will be critical in combating this crisis. Fortunately, over the last 3 months, many African countries have quickly moved from readiness to response as more COVID-19 cases appear. Good practices from Africa's response to the Ebola outbreak and lessons learned can be a good yardstick in further strengthening the continent's response to the COVID-19 pandemic. Africa's experience once again demonstrates that government matters, and it has a key role to play in leading and coordinating response and recovery. Cities and local authorities also play an extremely important role in effectively delivering inclusive services, especially to the vulnerable groups which are the most affected in a pandemic like the one we're currently confronting. We at UNDESA, together with the entire UN system of regional and country offices, are closely monitoring the economic and social impacts of this crisis, and we stand ready to help member states navigate the policy choices ahead. We're also looking at how our capacity development activities can be adjusted quickly to the demanding and fast-evolving challenges that are being faced by all governments. And so, ladies and gentlemen, with these few words, I'd like once again to welcome you to this webinar. I wish us all a very fruitful and successful webinar and rich discussions, and I thank you all for your attention.
Thank you very much, Assistant Secretary General, Mr. Harris, for your welcoming remarks. I would now like to invite Mr. Temba Kalwa. He is the Senior Regional Coordination Officer of the UN Development Coordination Office for Africa, who will deliver his opening remarks. Mr. Kalwa, you have the floor.
Thank you so much.
Supposed to be on the conference.
Good evening, colleagues, distinguished excellencies, ladies and gentlemen. In Africa, we know that the COVID pandemic has come in a context where there are already so many fragilities, as I think Assistant Secretary General Elliot Harris has pointed out, weak health systems. And what we are seeing is that the pandemic has revealed huge gaps in our systems, and there's no area or no sector that hasn't been impacted. Just to give a few examples, we know that at least 330 million learners from early child development to higher education have been impacted. We know that the pandemic is having high or huge implications on the food security. There are at least 73 million people in sub-Saharan Africa only that will be hit by food insecurity by the end of this year. We know that ECOWAS has...
is blocked.
And where is it blocked?
I don't know why is it like that.
But at the same time, we also see lots of opportunities. There are so many opportunities for local production, local manufacturing. We're seeing a lot of resilience in the communities. But I want to highlight a couple of things that resident coordinators and UN country teams in different countries across Africa are doing. As we have noted that for us to be effective in this pandemic, we need a whole of a system approach, a whole of society approach. And that also applies from the UN side, that we need a whole of the UN system approach. The resident coordinators in all the 54 countries in Africa, first of all, have been supporting Is it on? Hello?
Yes, we can hear you. Go ahead.
Did you hear me from the beginning?
Yes, thank you.
Okay, all right. So I was just highlighting what resident coordinators and UN country teams across the 54 African countries are doing. First of all, they've been very actively engaged in supporting governments with the national response plans. The UN country team and resident coordinators have also been at the center of supporting governments in the health and socioeconomic response. Thirdly, they're supporting governments with resource mobilization in partnership with international financing institutions. Fourthly, they're really supporting the governments in Africa in outreach and communication to make sure that the key messages about the pandemic are reaching the furthest people that are at the risk of being left behind. And lastly, resident coordinators are also actively involved in procurement and logistics. But based on the early experiences so far, I want to highlight three things. One is the importance of multi-stakeholder partnerships. Secondly, the need for us to ensure that as we respond to the pandemic, we are also taking into account the 2030 agenda in the context of Africa, the Agenda 2063, and that we leave no one behind. And lastly, the issue of innovation. If we are to build back better to a world that is sustainable and a world that is more inclusive, we need innovation. And I think it's platforms like these, discussions like these, that bring together different stakeholders from government, civil society, academia, UN, and development partners that are so key in us finding innovative solutions. Thank you.
Thank you very much. Thank you for these very concise and inspiring words, particularly the value of multi-stakeholder partnerships. Thank you very much, Mr. Kalwa. I would now like to invite our next representative, who is Mr. Alan Mukungu. He is the officer in charge. He is Economic Governance and Public Finance Section, Macroeconomics and Governance Division of the UN Economic Commission for Africa, to deliver his opening remarks. You have the floor, Mr. Mukungu.
Adrian. Thank you, Adrian. And colleagues, welcome to this new way of working, all protocol observed.
At least
the ECA to support African member states in socio-economic development of the
Hey guys. Hey,
one is with
yes. Are you okay, my baby? You're grown.
The attention of the member states.
And my kids look so beautiful. Am I your go-go?
Issues. And three, we operate, provide advisory services to member states.
Maha, you're not looking.
Sorry. May I just ask all the participants, please, to mute yourself, because there's a lot of background noise and we cannot hear Mr. Mukungu. Please mute yourselves. Thank you very much. Mr. Mukungu, go ahead. Apologies.
So since the emergence of COVID-19 pandemic, ECA has supported Africa's member states in several ways. One, under the think tank role, we have carried out a number of assessments which have informed an understanding of what is happening on the continent, but also what needs to be done, and therefore which policies to implement. We have about 5 reports that we can talk about in the last 3 months. And we also have used these particular reports to engage the member states. We called the ministers of finance and economic planning together to discuss the reports. We identified issues. And one of the key issues that arose from all of this is the whole business of a confined fiscal space. And so we've worked with the member states to advocate collectively at the G20 and with IFI institutions to start with, to try and get additional fiscal space from not necessarily handouts, but trying to rebalance conditions so that countries, instead of having to repay debts in this period, can have a debt service standstill, which has been granted to the IDA countries by the G20 group. We have also convened a global debate on Africa's COVID-19 lockdown, trying to look at the exit strategies for countries. 45 countries have already imposed lockdowns in their countries, and now they're thinking about how do we come out of this lockdown. So it is crucial for the response to COVID-19 to comply with fundamental principles of effective governance for sustainable development, and to ensure that all member states, citizens, and civil society can continue to benefit from the provision of essential services. So with minimum disruption, and have trust in authorities to achieve the ambitions of the decade of action for SDGs. So from this perspective, what ECA has been doing, I'll just pick up a few things that ECA has done in this way. One, we are working with civil society coalitions to design sources that are being provided to countries, to monitor them, to see what they are intended for, who they are intended for, and how they are being utilized, and how countries are accounting for those resources, not only to the sources of the resources, but also to the people who are supposed to be the beneficiaries. Then at a country level, we are working with the country teams. In this case, we worked with the UNDP. We are supporting the Ethiopian government to design a whole system approach, as Demba has alluded to, in responding to COVID-19, while also ensuring that there is a smooth transition to recovery and long-term growth. From the private sector side, we are working with Afri-Exim Bank to facilitate pharmaceutical firms in Africa to produce PPEs for Africa, but also to supply fertilizers to farmers in West Africa in time for the planting season, to ensure that there is food security in the near future. So I thought I should just pick out some of the key things that we are doing. We are working on knowledge generation. We are working on convening people to discuss and come up with strategies for addressing issues. But we are also at the operational level supporting countries to implement the recommendations from those knowledge products and discussions. Thank you very much.
Thank you. Idris Doum. He is the director of the Program Delivery Division, and he's representing Dr. Ibrahim Assane Mayaki, the Chief Executive Officer of the African Union Development Agency. I would like to give you the floor to deliver your opening remarks. Mr. Adoum. Mr. Adoum, you have the floor.
Hello. Hello. Can you hear me?
Yes.
Yes. I don't think Mr. Adoum is available, but I'm going to give our own opening remarks on behalf of the AUDA. So on behalf of the Chief Executive Officer of the AUDA, we would like to thank UNDESA for partnering with us and the other agencies, AAPAM and UNECA, in this important conversation, because it is important, I think, that we converge all the brands that we have in Africa and beyond to ensure that the region has an effective response mechanism. I will switch off my camera because of bandwidth. Okay. Essentially, I think from the African Union perspective, we recognize that, yes, the whole of government and whole of society approach is important. And if you look at the early responses, member states who have done a bit well in terms of being ready to respond are those member states where there is already an existing public agencies or the public sector, private sector, research and development institutions with innovation, where there is already a partnership. For instance, a case of South Africa. So in that instance, it really speaks also to the bedrock of sustainable development. And this is reflected in Agenda 2063. If you look at its ambitions, it's on socioeconomic transformation, where there is key partnerships and the enhancement of Africa's own productive capacity. So in that instance, if you look right now, the whole pandemic has shed a light on the structural weaknesses of Africa in terms of its own institutions, how well linked they are. And so from that perspective, it tells us really where our member states also have been putting a lot of investments in. So the issue of budgeting, what has been priority for member states? Because for a long time, we've had a case where we were calling for enhanced investments in health, and enhanced investments also in productive capacities, because you see that these capacities are essential at this point in time. So just quickly to focus on what the AUDA and basically the AU has put in place in terms of its own response, we find that in response to, in addition basically to member states on innovations at the domestic level, you have the regional issue, the regional dimension becoming very important, a continental approach becoming very important. And you see the Africa CDC playing a critical role in terms of marshalling the private sector, the industrial production of test kits and all that. And we also see a lot of partnerships coming through, for instance, the AUDA and EcoBank providing a platform, basically in terms of for reporting and assisting small to medium and macro enterprises in terms of the recovery period to that. And I think I have just maybe 1 minute left, but also what you see is that we're putting in place in Africa Recovery Plan, the blueprint. And for this, we basically are highlighting and we're embracing Africa in its own diversity, where we understand that we have stable states, we have post-conflict and we have fragile states. And we won't have a one-size-fits-all. And therefore, the issue of having financial packages, socioeconomic packages that basically reflect and are able to cater for all the breadth of member states that we have and the conditions and context that they are in. So essentially, if you look at what's happening right now in terms of galvanizing, financing the private sector, it's all in a way, it looks like mitigation, but it's actually going to boost the implementation of the African Continental Free Trade Area, because it does require Africa to have its own productive capacities and to mobilize its own resources domestically. I'll just end there for now. Thank you.
Thank you. Thank you very much, Ms. Florence Nazare, for your insightful remarks and for highlighting that there are no one-size-fits-all solutions, and that this, as much as it's a challenge, it's also an opportunity to build back better together. I am now delighted to invite Dr. George Scott. He is the Secretary General of the African Association for Public Administration and Management, AAPAM, to deliver his remarks. Dr. Scott, you have the floor.
Let me first of all bring you warm greetings from the African Association for Public Administration and Management at this critical time of the COVID-19. As African Association for Public Administration, we are involved in building capacity through conferences, training, meetings, publications, research, all aimed at efficient service delivery and development of our continent. We provide platform for discussions and articulation and sharing of ideas and new knowledge. Currently, all governments and countries of Africa participate in our programs, and our participants include ministers, other politicians, heads of public service, directors. We also have academia, researchers, practitioners, individuals, and students from the public service, NGOs, civil society organizations, international organizations, and many others. With these platforms, and as an institution involved in sharing knowledge and building capacity, we are aimed at enhancing, good citizens, the good of citizens. We seek to actively participate in the journey to fight the COVID-19. With Africa's fragile economy, many of the issues have already been highlighted already, so I don't need to elaborate on that. And we have weaker health practices. This is the time to step up and transform our governance system, enhance leadership, accountability, people's participation, innovations, and efficient resource management in order to meet the challenges of COVID-19. Obviously, Africa is plagued by many other types of COVID-19, including our economy, our social systems, and political systems. In these circumstances, APAM is grateful to the UN DESA for organizing this webinar meant as exchanging ideas and to find solutions to the COVID-19. As APAM, we promise to champion the dissemination of the outcomes of this webinar by UN DESA and to facilitate implementation of key useful solutions that will come out of this webinar. We add our voice to the participants and viewers of this webinar, believing that we will learn lessons to come out of this fragile disease and through that create a better, healthy, and more prosperous world for all of us. Thank you very much.
Thank you, and thank you, Dr. Scott, very much for those encouraging words and for all the work that APAM is doing also in Africa. We will now begin our panel discussion where we will learn from different countries what their experiences and governance strategies are to address COVID-19. I would like to introduce Her Excellency Professor Margaret Kobia. She is Cabinet Secretary in the Ministry of Public Service and Gender of Kenya. She is also member of the United Nations Committee of Experts on Public Administration. Minister Kobia, what are the major policy actions your country has taken in addressing COVID-19? And could you share any lessons learned with the audience? Minister Kobia.
Thank you very much. Excellencies, ladies and gentlemen, I bring greetings from the Kenyan government. And we did experience the first COVID case 14th March. And immediately we experienced that, we took it like a crisis and an emergency. And the major that you can hear me? Okay, the major policy action that we have taken as a government, the first thing we want to do is, with the leadership of His Excellency the President, we need to come up with a plan that we are going to use to respond to COVID. Within the plan, of course, we have to look at the resources available, which means we have to look at our budgets and do the allocation of budget to be able to fund the COVID-19. Some of the funding was going to go to medical response, where we are trying to see how do we strengthen our healthcare system and also motivate and encourage and even calling back some of our retired medical care workers to come and support the fight against the COVID. Of course, we needed those resources also to be able to use for PPEs, tracing, and also the contacts and the quarantining the people. We also looked at the government decided to look at the tax relief so that we can introduce some economic stimuli where some of the small and medium businesses could also be saved, because about 80% of our small businesses, that's where the jobs are. We also looked at, now that the schools were closed, you have to university level, we decided to use and leverage on technology so that we could continue with some online classes. And the other emerging that went on is also, we decided to support in line with the health measures and distancing, which means a lot of the public officers where jobs could be done at home, we decided to work around a very quick protocol and guidelines of how people could work from home and support their offices. We also felt that we needed also to support some of the organizations in terms of giving them some a little funding so that they could not send people home, because in our context, one of the biggest challenges is joblessness. Therefore, any effort that retains people at the place of work was welcomed. The government also felt they could not do this alone. They invited other partners, multinationals, Kenyan business people, to establish a COVID-19 fund that could be used to supplement government efforts and support the budget as well. We also thought that because there were quite a number of people who are vulnerable and needed social protection, because now most of them, 60%, and lost their jobs, especially those in small businesses. So the government decided for the very first time, giving them food was going to conflict or give a challenge. How do you ask people to come for food in one common area without and to ensure the social distancing? For the very first time, we borrowed what we call cash transfer, which gives people more freedom to go to the shop and buy whatever they needed. We have found it really more workable than before, including where women can now be able to have a choice to buy some even sanitary wear. On lessons learned, we have learned that effective leadership during the time of crisis is very critical, especially led by His Excellency the President, the Cabinet, and all cascaded down. And of course, we have also learned the three arms of government, right from Parliament, judiciary, is very critical. Communication is also very key. And when you communicate, you also need the right data, because also we have found this is an era of fake news. We have also found that we need partnership, bringing civil society, academia, and all people to work together and to be on the same page. We have also realized people call for accountability and transparency, especially on the funding, which come from government and what was raised by other people. Therefore, it has come that we need to be very participatory. We also need to recognize opportunities. We very much dependent on manufacturing from outside. Now we have started preparing our own PPPs. I think I want to stop here. Maybe later on, if there's time, I can come back with some of the dilemmas that we are facing. I thank you.
Thank you, Minister Kobia, for very concise but insightful remarks. I would now like to introduce Her Excellency Ms. Paola Pisano. She is the Minister for Technological Innovation and Digitization of the Government of Italy. Minister Pisano, how can innovation and digital technologies in government help to address COVID-19? Can you please share with us any good examples or lessons learned? Minister Pisano, you have the floor.
Hi. Hello, everybody. Thank you for the invitation, and I'm very glad to have the opportunity to share our experience while dealing with these challenging times. The COVID-19 pandemic is causing large-scale loss of life and severe human suffering globally. It is the largest global health crisis in living memory and is having devastating impacts. At the national level, governments have taken bold measures. Many countries have declared national emergencies to contain the spread of COVID and put in place measures to mitigate shocks to the health system, the economy and financial markets, and alleviate people's sufferings. I think that we have a duty to contrast and limit as much as possible the damages and pain caused by COVID so far. Today, we can take advantage of means that did not exist when other terrible pandemics marked history. I believe it is a duty for our society and the people we care for to use technological resources such as the internet, mobile phones, data, software, and algorithm. Obviously, I do not think that technologies has salvific power or represent the panacea for the present crisis. Technologies are neither good or bad, but we have to be cautious in the way we evaluate and use them. However, we are children of our time, and we should commit ourselves to manage the crisis and turn it towards a more profitable direction for society's well-being. I would like to share with you the initiative that the Department of Digitalization and Transformation, which is under my responsibility, has launched in collaboration with other ministers, in particular Health, Economic and Development, Interiors, Justice, Education, and University and Research. As soon as it became clear that the health emergency was weighing heavily on the lives of our citizens, we launched 5 initiatives which I'd like to present. The first one, named in Italian Solidarietà Digitale, and in English is Digital Solidarity. We launched a public call to the private sector and association to offer their products or digital services for free. We wished with this initiative to help citizens to continue their activities and maintain their daily routines, even if they could not attend school or go to work during the containment measures. The second initiative was done within the Cura Italia, that it was a law decree, and we introduced measures that simplified the procedure, decreased bureaucracy, and authorized administrations to purchase IT goods and services through a simplified negotiated procedure and not with a complex tender. The third one, we launched an initiative called Innovation for Italy, and we invited companies, universities, public and private research center and association to provide innovative solutions to solve the most relevant problems for COVID. The first one was decreased infection, the second, preventing the infection, and the third one is increasing the personal protection. Our fourth initiative was a fast call on telemedicine and data analysis with the aim of identifying the best digital solutions available in the field of telemedicine and contact tracing. The fifth one was the creation of a data-driven working group for COVID-19. They start working on 8 different tasks, such as socioeconomic impact, the mobility impact, and the infrastructure, and collect and analyze data. Within the working group, 2 expert groups focus on evaluating the contact tracing application and the privacy issue in data management. So we select an application for contact tracing based on Google Apple operating system and respect some fundamental principles for our country. First one, it's important that this application is managed by a public entity and the code is open. Second principle, very important for us, is that the data processed for operating system has to be anonymous. The third is that the decision to use the technological solution, so the application of contact tracing, is voluntary based. The fourth one is once the emergency will end, all the data will be deleted. And the fifth one is that the solution adopted is effective on the purpose of tracing the Epidemic. And finally, the app does not collect any geolocation data from users. Last but not least, we have proposed and passed a law so that the above principle can be enforced. We need to complement national efforts with multilateral collaboration on pandemics prevention, including improved information sharing on potential new threat and health systems threatening. We need to better understand also the interdependence between health and environmental challenges and make the most of digitalization of health data and new tools such as artificial intelligence. I think that we also need not to lose the speed we gained towards the country's digital transformation. For example, in Italy, all the students now are attending classes online, and most companies have fully adopted smart working, and e-commerce is booming, and the digital delivery of public sector services has dramatically improved. For this reason, we have created in the past weeks a mobile application to access all public administration services, and we are pushing inside our country the ultra broadband, and we have just unlocked 1.4 billion euro to connect all the schools through ultra broadband technology. Of course, we cannot lose this momentum, and we should offer the opportunity also to those who don't have them, to young people who do not have internet access and cannot study online, to the elderly who do not have the skill, but who through the internet and from home may still connect with children, with their grandchildren, and shop and complete transaction. The lack of internet or connectivity should not create a divide between citizens inside the countries. But the internet, the innovation, and the digitalization should improve quality of our life and social and economic opportunities for all peoples and all countries. I think that it's possible, and making it happen is one of our tasks. Thank you very much for your attention.
Thank you very much, Minister Pisano, for highlighting such interesting initiatives, those 5 initiatives, and the roadmap that your department and the government of Italy have put in place. Thank you very much for those remarks. I would now like to invite our next speaker. It is Mr. Lan Shui. He is professor at Tsinghua University. He is also member of the Committee on Emergency Management of the State Council of China. And I would like to ask Professor Shui, how can government effectively assess the dynamically evolving situations of the COVID-19 pandemic and prioritize policy actions to address the situation, especially at the onset of the outbreak of COVID-19? Professor Lan Shui, you have the floor.
Okay, thank you very much. Can you hear me? Thanks very much for inviting me to this webinar. I think it's fascinating and to hear the experience from many other countries. I think that the first, I think I would like to divide the response, in terms of how to assess the dynamic situation and make decisions, maybe into 2 major decisions, major stages. The first stage, I think, is maybe for many other countries been more to the early stage. I would say that here is sort of more of a risk management stage. I think the first thing I think that needs to be done is to sort of monitoring the situation on the what is the case, particularly around the neighboring countries, and also what's the situation with the infections within the country. I think that usually at the early stage, how to really identify those people who are infected. Hello? Somebody, okay.
Yes, please, everybody who is not speaking at this moment, kindly mute your microphone so we can listen to Professor Alain Shui. Please go ahead.
Yeah. So basically, I think the so the risk perception and risk a sense making of the situation, I think, is very critical. Here that there's a need to test the people who might be infected or who might be in contact with people. So I think that's very critical. I think that with those information, I think there's a need to analyze.
Professor, is it that perhaps you're too close to the microphone? Yeah, maybe let's try. Thank you very much.
Yeah.
Please go ahead.
Yeah. So I think that the first thing I think is, of course, is try to identify, to monitor the situation. I think the second stage is also analyzing the situation. To analyze what might be the curve, how might the curve move, and how what actions might be needed. I think there's some need for more analysis of the evolving situation, and also to communicate that with the public, because ultimately whatever actions you're going to take is going to rely on the cooperation of the general public. I think the more the general public understand the situation, the better they will work with the government to respond to the crisis. So that risk communication is very critical at the early stage. I think the next stage, once we get to the sort of more of a outbreak, rapid spread situation, I think then there's a need for decisive action. The decisive action, I think, is first. I think that of course, we really hope that the government, can make decisions ahead of the curve. I think that now, in China's case, now in hindsight, that lockdown of Wuhan city seems to have, generated tremendous benefits. Although at the time, it seems to be a very hasty decision, but it turned out that worked. Had that lockdown was delayed, I think the situation could have been much worse. So I think, how do you move ahead of the curve? That's always a challenge. And so I think that risk communication with the public, I think is so useful, because I think if people understand the potential problem, then I think when you do that ahead of the time, then I think that policy would work. So I think that's probably the first thing is how to move, make decisions very quickly. The second thing is also how do you prepare for the surge demand? Because I think when the situation like this, it's going to get to the rapidly, the cases are going to increase, and then you have a huge demand for medical staff and protection gears and also medical beds. So I think that no country, China is such a huge country, and even at the peak time in Wuhan, nationally we mobilized over 40,000 medical staff to Wuhan city alone. Wuhan is a city with already, with quite well-established medical facilities, but still there's such a need for that. When there's such a surge demand. So how do you prepare for that? I think that's something also very challenging. And the third is how do you get the community work? Because ultimately, I think whatever the measures you take, it would have to really to be implemented at the community. And I think that at the community level, how do you get the people, NGOs to work and get the general, self-helping groups and so on? Because you might have people who might be quarantined at home, but who can help them to deliver the food. So you need that community network to play their role. So I think that also is a very critical part. So I would say that those are some of the key elements. Of course, I think the information technology and many other things that also will have to come to play. I think at the third stage, I would say that the stage when there's kind of a recovery stage, I think I would say how do you play through the balancing act. I think that I know I think some countries are now, particularly some European countries are going through that stage. I think that in China now has gone through that. I think here I would call sort of more of I would call sort of adaptive governance is really important. When I say adaptive, that means you really have to to how do you make decisions based on the differences of different regions, of different sectors. For example, in China, there are over 40,000 counties, over a very different situation. So I think at the beginning of the recovery stage, so we divided based on the number of cases, based on the the decline and so on. We divided them into three kinds of categories: high risk category, middle risks, and low risk categories. So based on the what categories they are in, then they are allowed to have some activities resuming. In terms of the social and economic activities resume. During this period of time, some region may actually return from low risk to middle risk or even high risk. Last few days, I think there's one county in Jilin province that became sort of high risk. They suddenly had probably a dozen or so cases. So then they return to high risk, and so there's a whole set of measures that be implemented. So I think that's kind of a differentiated policy. I think for different regions. They also for different sectors also there's a need to differentiate based on the need. For example, now in Beijing we now allow schools to return, students to return, but not all of the students to return. For example, the first stage is graduating class. They can now return to the schools. And hopefully that in the next few weeks, there'll be gradually others, cohorts will be allowed to return. So I think you really want to, to make, to really resume very slowly but carefully, so that it actually will not, generate, second or third wave. So I think those kind of measures, so using an adaptive approach, moving in and then assess, what's the situation, and then expand the policy measures, and then allowing the return to the normality. So that's some of the issues, the policies that can be implemented. Yeah.
Thank you very much, Professor, for this comprehensive response and for highlighting the importance of adaptive governance. I would now like to move on to our next speaker and introduce Dr. Young-Kyun Kim. He is the Director General of the National Disaster and Safety Control Center at the Ministry of the Interior and Safety of the Republic of Korea. Dr. Kim, what leadership capacities are required at different levels of public institutions, and how are innovative technologies leveraged for effective responses to COVID-19 in your country? Dr. Kim, you have the floor. Dr. Kim? Dr. Kim, can you please unmute your microphone? Dr. Kim, perhaps you have some connection issues. Can you speak, please? Can we see if the connection is working? Perhaps you need to turn up the volume. So what we will do then is I will now then move to the next speaker, and when the connectivity issues or the mic are fixed, we will then go back to Dr. Kim. So we know that cities and local authorities are at the front line of combating this pandemic. Of course, national governments play a critical role, but cities and local authorities also have a very important role to play in combating this pandemic. And that's why it is our great pleasure to invite Ms. Jennifer Samakula Musisi. And she is the city leader in residence of the Bloomberg Harvard City Leadership Initiative of the Harvard Kennedy School. She was the first executive director of Kampala City in Uganda, and she has 3 decades of experience in transforming institutions. So Ms. Musisi, in your opinion, what is the role of local authorities in combating COVID-19 pandemic, and what are the key factors for effectively responding to COVID-19 at the provincial and local levels? Ms. Musisi, you have the floor.
Hi, Adri. I hope you can hear me now.
Yes, certainly, I can hear you.
Yes, local governments are the front-facing link between national governments and the population, especially at this time where they are leading the effort to support and sustain populations in the different countries. They're also playing a very critical role in the efforts to lower the pandemic and the rate of infection, and also providing reliable, accessible data to the populations. They need a lot of vital information. So local governments are doing the work of effectively communicating in the face of a lot of unnecessary and sometimes unfactual data. They are also working to respond to the different impacts of the population, to the populations they lead, and ensuring that they are continually keeping people safe and healthy throughout this time. They are also working to keep vital services going, because much as we have a pandemic, we still have to have the vital services continuing amidst strained resources for most of the cities and urban centers. They are also at the same time playing a critical role in planning and implementing post-COVID interventions that are beginning to come up on the horizon. And some of the key factors that are considered in order to be effective in their work, local governments have to work to eliminate duplication and overlap of roles, dividing activities, specifying who controls the funds, defining the crucial decision makers, and working to support the overarching national response strategy, which is taking place in most countries. In this way, they are avoiding confusion and waste of resources. So eliminating duplication and overlap is very critical at this time when everybody is trying to do something. They also, as local governments, need to have a very strong crisis response system, and many of them have strengthened their response systems and identified resources which they're using to identify challenges and vulnerabilities and therefore be able to rapidly respond as the needs emerge. They're also working to strengthen integration across players. As I mentioned earlier, there are a lot of players in this effort to tide the pandemic, and they are working to link up communication platforms and have consistent messaging to the population and to the other players to enable speedy responses. Looking back at the Ebola and SARS experience, it was very evident that involving citizens played a very crucial role in communicating and reaching communities. So local governments have to continue involving citizens in this communication and reaching communities, and therefore linking to the crisis responses that they are running as the pandemic continues to ravage. They also need to be able to continuously and effectively respond to needs. The population at this time needs all the support that they can get from the local governments wherever they are, and they need to be able to equip themselves with personnel, with equipment, with systems, and with resources to be able to respond effectively. Those are some of the things that local governments are doing and continue to do, but also some of my thoughts concerning how they can be more effective during this time. Thank you.
Thank you. Thank you very much, Ms. Muzisi, for your highlights, and especially, for highlighting how important it is to involve everyone and all civil society organizations as well. Thank you again. I would now like to see whether Dr. Kim is online. Dr. Kim? So we will move on then to our next speaker. And we know that when we are confronting a pandemic of this magnitude, governments have a central role to play, but so do other actors in society. And we already heard that from our previous panelists. And the private sector is a very important actor. And its efforts are crucial in such moments of crisis. Therefore, I am delighted to introduce Mr. Sunil Janes. He is the Director of the Government Relations and Corporate Social Responsibility, Global Government Affairs of SAP Africa. Mr. Janes, in your view, how can the private sector, particularly the ICT businesses, effectively contribute to whole of society efforts in combating COVID-19 in African countries? Mr. Janes, you have the floor.
Thank you, Adriana. It's a pleasure to be part of this WebEx. I think we're facing unprecedented times. The private sector and government, as well as citizens, will have to support each other during this process. Critically, the private sector needs to collectively support efforts that government is putting together, supporting new regulations that are being developed, supporting in areas where private sector has both skills and attributes that the public sector does not have, but importantly to ensure also that the customers of these private sector organizations remain quote unquote open through digital means, and over and above that, for private sector companies to support what we would call essential services, your hospital, your healthcare centers, at the front line. And this is where it's important for private sector to step up, not only in the sense of providing capital, but more importantly to demonstrate how their collective wisdom can benefit society. Now, in South Africa, for example, the private sector has got together and established something called business for South Africa. It's a response for COVID-19. And this is where all the organizations come together and support through work streams in addressing issues of health, particularly labor, the economy itself. And this is forming an integral platform in the way that the private sector is actually responding to the challenge in a coordinated mechanism. Obviously, as SAP, a global company, we immediately saw a need for our emphasis and our impetus behind this particular challenge. And in addition to providing free of charge several solutions, which I won't be able to go into all of them right now, but I'll put it on the chat. For the public sector, the private sector, university students, people who want to improve their skill sets, we've put a number of solutions out into the market space free of charge. And in addition to that, as a global organization, we set up an emergency fund of 3 million euros to support in those countries which have been ravished by this pandemic initially and continuing across the globe. And we've seen a huge uptake in that, particularly in countries where there's difficulty with food security, for example, and also for small, medium enterprises to sustain themselves during this very difficult time that we find ourselves in. And then, not to leave the youth out, we also partnered with UNESCO to set up something called Code the Curve, where we're able to elicit the collaborative work of young people to put together solutions that could address COVID-19. And then I suppose I should round off by saying that if ever there was a doubt about digital transformation globally, that doubt has been set to rest. It's critical that everyone is given the opportunity to be part of this digital economy and to be able to participate in it. And private sector needs to come behind government and the general society at large in creating situations where more things that were paid for in the past become public goods. And I want to end on the one note and listening to some of the other speakers. Bandwidth and data in Africa is critical for many people, community organizations, citizens, and community organizations to access digital content as well as digital offerings. They need bandwidth, and that is where the telco companies need to really come and play a critical role. So let me pause at that stage.
Thank you very much, Sunil, for that concise but quite interesting remarks with some good examples. Now we would like to give the floor to Ms. Yetnebersh Nigusi. As you know, in a crisis like the one that we are experiencing, no matter how well prepared governments are and how active the private sector is, social responsibility and the involvement of civil society organizations are crucial in reaching out to vulnerable groups who are the most affected by this pandemic. Ms. Yetnebersh Nigusi is the Senior Manager of the Global Action on Disability Network, International Disability Alliance from Ethiopia. Ms. Nigusi, how can civil society organizations be effectively engaged and contribute to delivering emergency assistance to vulnerable groups at the local level and also foster community-led COVID-19 response efforts? Could you share with the audience some examples? Ms. Nigusi, you have the floor.
Thank you very much. And it's really great to be part of this distinguished panel. It's apparent that vulnerable groups, including persons with disabilities, women, aging population, have been significantly and disproportionately affected with this pandemic, not only with the disease itself, but also with the overall socio-economic impact. I can see the role of civil society organizations in filling the gap in making sure that no one is left behind. When we say no one, it should be really no one. So making sure that hello? Making sure that legislations passed by governments are human rights compliant, and making sure that groups not identified by formal systems, including a number of packages identified by government, is a role that civil societies can play. For example, we were listening about staying home. We have quite so many people in Africa who does not have home. Where is home? So governments should be coming up with alternatives, but in the meantime, civil society organizations help in making sure that those who doesn't have home to go have an alternative place to stay. Above all, different situations, for example, as indicated, different solutions being provided by the government, including digital education, may not be of good solution. We have witnessed in quite so many African countries, children with disabilities are out of school and they're out of the reach of the digital technology, as instructions and lessons are not provided with sign language and functioning. A number of support services required by older people as well as by persons with disabilities are not being given due to the emergency that we're going through. So civil societies can help in filling this gap and also help in identifying where this vulnerable population are. In many cases, those vulnerable people are not registered, they don't have addresses, and the formal mechanisms do not reach them out. I heard a good example of cash transfer, for example, from Excellency Cabinet Minister from Kenya. That may not be a good solution for persons with disabilities and elderly people. Though they have the cash, they may not be in a position to stand in a queue to buy the items. Come up with innovations, including giving them the items directly or arranging volunteers to buy for them and deliver them. We know in countries like Australia, there have been, and also in UK, there have been dedicated times for senior citizens as well as persons with disabilities for buying. Otherwise, items will be out of stock and those people will not have access. We also understand that there are a number of packages, including financial packages, being introduced by the government. Unfortunately, many of the African vulnerable groups, including women, African women, are street vendors who just sit on the road to sell daily items to feed their families. And neither the tax holidays nor the socioeconomic recovery plans would reach those women, as they are not part of the big businesses that we are talking about. So civil societies can play a role in bridging the gap and in connecting the real poor towards the pandemic and minimizing the impact. I would like to say that what is needed from the government in terms of this civil society engagement is that we need to widen the civic space and make sure that civil societies are continuously consulted and involved in the pandemic response in every country. In my country, Ethiopia, the civil societies have got their own accounts and working platform to make sure that they connect with the government and take part in the response. We have witnessed also some innovations and exceptions that governments have done. Coming back again to my country, Ethiopia, for example, persons with disabilities were exempted from car bans in movement and so that they can move freely. However, I believe that this pandemic was a real test to humanity to check how we're doing in terms of leaving no one behind and ensuring that no human rights is violated. So we need to work more and become innovative and address the concerns of vulnerable populations. Mainly, we need to consult with them continuously. We need to be innovative of what can work better, because as has been said, one size does not fit all. So especially in Africa, where bandwidth is also a problem, we really need to remind that we have a promise in 2015 to leave no one behind, and that applies again in a humanitarian setting. Thank you so much.
Thank you. Thank you very much, Ms. Nigusi, for highlighting the importance of inclusion of vulnerable groups and the importance of consultation and participation of civil society in the decisions that governments make in addressing COVID-19. I would now like to see if we can connect with Dr. Kim. And Dr. Kim, we would like to ask what leadership capacities are required at different levels of government, and how are innovative technologies leveraged for effective responses to COVID-19 in your country? Dr. Kim, I believe you're connected. You have the floor.
Thank you, Adriana. You asked me about the required leadership capacities and the use of innovative technologies during the COVID-19 crisis situation. Can you hear me?
Yes, certainly. Thank you. Go ahead.
Okay, great. Yeah. So first, the leadership of the President, Prime Minister, and head of the Korea Center for Disease Control and Prevention, Korea CDC, have played critical roles in fighting COVID-19 in Korea. They show that identifying emerging issues, making evidence-based decisions, unifying administrative efforts through bureaucratic process are essential features of crisis leadership. Understood the rapidly changing crisis situation and made proper decisions based on expert groups' advice. He put the national priority on mobilizing all available resources to prevent the COVID-19 outbreak while keeping the entire process transparent to the public. In the extraordinary virtual G20 summit held on March 27 of this year, President Moon emphasized that stronger global solidarity is essential in overcoming this novel global crisis. Also, Prime Minister Jung Se-kyun stayed in the severely affected region for 3 weeks in February this year and solved various problems in the field. He also chaired daily video conferences with the participation of relevant ministers, city mayors, and provincial governors. The conferences consist of situation report, various feedback sessions from participants, and debates about the expected problems and solutions. This democratic process helps to reduce the gaps between measures prepared by the central government and implementation in the field. Furthermore, both President and Prime Minister gave all the authority to combat the spread of COVID-19 to Dr. Jung Eun-kyung, head of the Korea CDC. With this empowerment, Dr. Jung was able to control all situations effectively. And during daily briefings, she explained the current situation and government measures candidly and sincerely. Thanks to her efforts, citizens' trust in their government response was built, which was a great part of Korea's success to fight COVID-19. Second, Korea's successful response was centered on widespread testing, contact tracing, and rigorous treatment, also known as the 3T strategy. This was made possible through technology innovation and the extensive use of ICT tools, along with the security protocol for data protection. The specific examples include the RT-PCR test kit, which can provide the test result within 6 hours, a rapid approval system to reduce the required time from 1 year to 1 month in an emergency situation, innovative drive-through testing methods, which allowed people to conduct the whole testing process safely within a vehicle. And the ICT-based quarantine information system that identified persons coming from high-risk regions and monitored them during the incubation period of the infection. Additionally, I would like to add clear roles and responsibilities based on the response manuals as another success factor. Korea has enhanced this infectious disease response manual through the double loop learning process in the response to SARS in 2003, H1N1 in 2009, and 2015. For example, the roles of response agents like the Korea CDC and the coordinating agency like the Ministry of Interior and Safety were clearly divided in the response manual. The Ministry of Interior and Safety took charge of monitoring and managing self-quarantined people, operating temporary living facilities for inbound travelers, and coordinating central ministerial support and local government countermeasures. With this backup, the Korea CDC was able to serve as a strong command center to prevent and control infection. In summary, I would like to emphasize three success factors behind the scene. Political leadership, which enabled transparency and championed democracy. The extensive use of innovative technologies and clear roles and responsibilities based on the response manuals. Before I finish my answer, for those who want to get detailed information about Korea's policy and technology, please join various webinars organized by the Korean government, and one of them, which will be held tomorrow, 5 p.m. Korea time. Thank you very much for your attention, Adriana, and more audience.
Thank you, Dr. Kim.
나가지 마세요.
And also thank you very much for providing information about the Korean case and the webinars that you are conducting. I would now like to see whether Dr. Yogam Pillai is online. I heard that he has some connection problems. Dr. Pillai, are you online?
Hi there, Dr. Pillai is just wrapping up on a previous call. We managed to connect him. So if you could give us 5 minutes and we'll be able to join completely.
Thank you very much. So we will now open the session with questions and answers. And before doing so, I would like to introduce Ms. Sarah Tafik Hamouda. She is an Agenda 2063 and Sustainable Development Goals expert of the African Peer Review mechanism. And we know that one critical aspect that makes the difference in combating this pandemic is partnerships and multi-stakeholder engagement. And we heard that also from our previous panelists. Therefore, Ms. Hamouda, we would like to ask, what is the role of inclusive and effective institutions and partnerships in tackling the epidemic at national and regional levels? Ms. Hamouda, you have the floor.
Thank you so much, Adriana. Good afternoon, colleagues, and allow me to really thank all the panelists for insightful presentations. In 3 minutes, it's really difficult to answer your 2 questions, but let me start by saying that regardless of the crisis and the challenges that Africa has to combat the pandemic, it's true that this is a wake-up call to reconsider the institutions and the role of formal institutions, as well as the partnership with civil society and private sector. It's also important to highlight the necessity to strengthening the regional institutions and initiatives that Africa has been working on, especially the Africa Continental Free Trade Area in this challenging time, because Africa, as you know, imported different pharmaceutical products from abroad, and now we have a supply chain challenges because of the lockdown. I think it becomes crystal clear that the COVID-19 crisis is probably the worst healthcare crisis over the last 3 decades in Africa. The African governments and national authorities have taken different measures to contain the pandemic. And of course, it's depending on what we call it, the adaptive capacity of the institutions. I was hoping that the South African deputy minister speak before me, but in South Africa, for instance, we can see how this crisis tested the collective action of the government. And I myself, as a foreigner living here, we received messages from the government to stay home, to raise awareness on the danger of the COVID-19 and so on and so forth. So inclusivity itself is a quite challenging term, and in order to see to what extent institutions are inclusive or not, we need to talk about leaving no one behind, non-discrimination, participation of different state actors, like what we have here in South Africa, the High-Level Council on COVID-19. There is a special task force at the presidency on the same issue. We have subsidiarity. We have also intergenerational equity. Another issue should be taken into consideration is the issue of statistics, and I think my have covered it properly. We have a lack of expenditure on healthcare in Africa. You have lack of data. Only actually, according to the SDG dashboard in Africa, 87% of countries scoring red when it comes to reporting on SDG 3, healthcare and well-being. So I believe that in the African peer review mechanism, we are trying to sort out all these issues through raising now VNR's virtual dialogues to report, to follow up with our member states on the progress regarding COVID-19, how they are prepared to submit their VNRs despite this problem. We have some good cases from Rwanda, Uganda, Mauritius as well. I think they are trying to compare the crisis properly. We have some partnerships also with the OECD, with the GIZ, SIDA, in order to offer more inclusive platform to include gender issues and youth in our topics, as well as also resilience, because building resilient institutions is also contributing to improve inclusiveness at African level. So I think I should stop here because I was given only 3 minutes, and I really enjoyed the discussion. So and also the presentations. Thank you very much.
Thank you very much, Ms. Hamouda, and also for being concise. I know that the time was short, but we hope to keep up our discussions also in our next webinar and our discussion board. I would now like to open, the segment with questions. We have been receiving quite a lot of interesting questions from colleagues and also from people from different countries. There are 2 questions. It's very difficult to select those questions, but some questions are quite complex. So I would like to ask a couple of questions, but I would also ask our speakers to please, keep their answer to 1 minute. This way, we would be able to get in more questions. So the first question is for Minister Pisano. And the question from the audience is, if the digital data from cell phones is anonymous, how can or does it support contact tracing?
Okay, thank you for the question. The thing is that if 2 mobiles have the application, they share an anonymous key to each other. So in all the mobile, the anonymous key will memorize. Once a citizen will feel not very well and go to the hospital and do the test for COVID and receive the positive result, then the doctor will give to the citizen an anonymous code, and the citizen will put this code inside his mobile, and in that moment, all the anonymous keys that were memorized on his phone will receive the message that they were in contact with a positive citizen. So for this reason, we memorize the anonymous key in a decentralized way on the mobile, the key in a central data center. This is how the contact tracing works. And I think an important thing is that normally in our health system, we are doing the contact tracing, but not the digital contact tracing. So when a person feels bad and go to the hospital and the doctor understands that he's positive or she's positive to the coronavirus, then the doctor asks to the citizen all the person that he was in contact in the previous 2 days. But in this way, you will not understand and consider all the people that you meet, for example, in a line, in the supermarket, or inside the bus, and all this kind of persons. So you lose a lot of contact that you normally have in your daily life. With the digital contact tracing, you can also insert in this tracing this kind of citizen.
Thank you.
Also one thing more, that in Italy, this application will be volunteer and will start probably, if we respect our roadmap, at the end of this month of the first week of the next month.
Thank you, Minister Pisano, for that very comprehensive information about the tracing. Thank you very much. There is another question that from the audience, which would be addressed to Ms. Musisi. And the question is, what strategies can facilitate coordination between national and local authorities? And Ms. Musisi, I know it's a huge question. You have 1 minute. If you can just give us, 2-3 key messages. Ms. Musisi, you have the floor.
Thank you very much. Thank you very much. Can you hear me?
Yes, I can. Thank you.
Yes, it's very, very important in this effort to have national governments working with the local governments. And this is something that national governments have to realize, and therefore provide resources to local governments to strengthen their capacity and ability to respond, give them additional financing, support their human capacity development, and help them acquire the resources they need. They also need to be able to provide them with information relating to initiatives that are being taken and involve them. Because if national governments do not involve the local governments, a lot of effort is going to go to waste because of the front-facing role that the local governments have to play. And therefore, their participation, the participation of the citizens through them, and also being able to exchange data on critical areas is very important. So both have to work very closely together if we're going to get maximum impact in this time of crisis.
Thank you. Thank you very much. I would like to know now if Dr. Yogam Pillai is connected. Are you online, Dr. Pillai?
Yes, thank you very much. I'm now online. Thank you for your patience.
Yes, thank you very much. So we had a question for you. So first of all, Dr. Yogam Pillai is the Deputy Director General, Communicable and Non-Communicable Diseases of South Africa, and he is representing His Excellency Mr. Joseph Fala, who is the Deputy Minister of Health in South Africa. Dr. Pillai, how can government ensure the inclusion of vulnerable groups in policy responses to COVID-19 with a view to their special vulnerabilities? Dr. Pillai, you have the floor.
Thank you very much. You can hear me?
Yes, please, everyone else, mute your microphone. Yes, please go ahead, Dr. Pillai.
That we've been using to both involve the various categories of people who we consider vulnerable in South Africa in the COVID response. We have a very vibrant group of non-governmental organizations in the field of people with disabilities, as well as the older people. And we have worked with them to develop a number of written material as well as material for radio, to use on radio, to look at what people with COVID, what people would present with, meaning the symptoms of COVID, as well as what they should expect over time with respect to people with disabilities. We also have guidance that we've provided for caregivers, including caregivers who have symptoms of COVID. So we've done a fair bit on that in that area. We've created a working group of people with disabilities, as well as people from the older groups, to advise us on both the material that we need to provide, as well as the interventions we need to take to protect people who we consider vulnerable. So we've been working very closely with the non-governmental organizations, especially to ensure that residential facilities that have people with disabilities and the elderly have the protective, personal protective equipment that's needed to protect them. Personal protective equipment to these homes and to communities that have people who are vulnerable in them. We've also come up with a question and answer sheet with typical questions that people would ask, people who are vulnerable. We've increased access to people with chronic diseases with respect to medicines. So we are now sending or couriering medicines to people who have chronic illnesses. And we've done a number of things for people with mental health challenges as well, with people with mental illnesses. We have guidelines for the interventions of people, so that they understand also the symptoms of COVID, as well as what needs to be done. We have been screening both visitors and the staff that attend and visit psychiatric hospitals. And we have strengthened infection control and prevention in our psychiatric hospitals to ensure that anybody who's in a psychiatric hospital is protected from COVID. So we've done a fair number of things to protect the vulnerable groups, whether they're people with disabilities, whether they're the elderly, and whether they are people with mental illnesses. Thank you.
Thank you, Dr. Pillai, and thank you also for providing those remarks in a very short time. I realize that we have many more questions than we can answer, and all the questions are extremely interesting, but we are running out of time, and I would now like to move to the wrap-up and the closing session. Therefore, it is my great pleasure to invite now to the floor Mr. Bukyun Shim for closing remarks. Mr. Shim is the head of the United Nations Project Office on Governance, which is part of the Division for Public Institutions and Digital Government of the UN Department of Economic and Social Affairs. Mr. Shim, you have the floor.
Thank you very much, Adriana. I'm Bukyun Shim, head of UNPOG, based in Incheon, Republic of Korea. I'm very happy to meet you all virtually. UNPOG is a project office on governance of the UN DESA, with a division for public institutions and digital government. I hope you have all enjoyed the insightful discussion so far, and I would like to thank you all for your dedication and participation in this webinar. Today's webinar was a valuable place to share the experiences and innovative solutions of each country in face of the COVID-19 crisis. I would like to share 3 takeaways on governance from today's discussion. First, COVID-19 is driving the vulnerable population to a survival crisis. This is why economic, social, and medical care for them should come first. Secondly, COVID-19 is spreading so fast and powerfully that it cannot be overcome with a single sector effort. Each sector should take ownership and accountabilities in their own positions. National to local actions should be effectively coordinated. Voluntary actions by citizens should be encouraged through transparent and communicative governance. Third, frontier technologies, including data analytics, should be fully leveraged for timely actions. Public governance needs to bring innovation and expertise to the forefront. The time was too short to cover all these issues today, so we are going to organize a second Africa webinar on innovative technology, tentatively on 17th June. We have also set up an online discussion board on the UNPOG website to share our opinions. We'll prepare a checklist on the core items of effective governance to address COVID-19 for your use. And finally, the evaluation survey is available on our website. Please complete the survey as your feedback will help improve our future webinar. UNPOG, as a knowledge-sharing platform on governance, will provide continued support for you all. Distinguished speakers and participants, in closing, please allow me to express my sincere gratitude to all speakers and our partnering agencies for their dedication and support for the successful event. Special thanks go to the audience for your continued attention. I also propose a special load of thanks to our esteemed moderator, Dr. Adriana Alberti, with whom we have co-organized this webinar. Thank you very much, and back to you, Adriana.
Thank you very much, Mr. Shim. So on behalf of DESA, our partners and distinguished speakers, thank you very much for joining us today. We look forward to your participation in the upcoming webinars that we will be organizing. And as Mr. Shim said, we hope that you found the webinar interesting, insightful, although we do realize that more time was needed because of the wonderful presentations and questions from the audience. So thank you, keep safe, stay healthy, and stay connected. We now end the webinar. Thank you very much to all the participants, and thank you, Excellencies, for joining us today, and for all the other representatives from academia, private sector, civil society, and all our partner organizations. A big thank you to all of you, and stay safe and stay healthy. Thank you.
Thank you very much. Bye.
Bye-bye.
Thank you, Adriana. Ciao.
Arrivederci, grazie.
Ciao, arrivederci. Grazie a tutti. Thank you very much. Bye.
Thanks, Adriana. Thank you.
Thank you very much.